I think a common misconception is that people think it's just a new, novel way of kind of fancy culturing your cells and make maybe a few pretty images to convince a reviewer that you did a cool experiment. But what I really want to stress is organ-on-chip technology is really changing the biology of the cells you're putting in. They behave very differently in a 2D culture versus in a 3D culture with perfusions, shear stress, stretch and strain stress. So cells start having different expression profiles. They start behaving way more like they behave really in the body. So organ-on-chip really matters if you want to create a model system that more resembles the in vivo setting than normal 2D culture.
I think a nice vision, but currently a major misconception is that you can simulate the whole body on a chip with organ on a chip. I think it's a purpose that it has the name organ on chip because we're still at this level. The body is really complex and I think on a molecular level not fully understood yet. It's a major challenge. So there are 2 or 3 organ models that work so far, but I would be really careful talking about body on chip. It is a nice vision for us. Of course, you need a goal to work towards, but it's way too early for this concept.
When I talk about organ on chip to people, especially people who are not in the field, they literally think that we take a whole organ and put it in some sort of chip. And they're like, what? And what is important is that it's important for people to understand that what we are trying to recreate within the organ on chip is that we are trying to recreate this basic minimal functional structure of the organ. What that means is that if you literally make a cross-section of the organ, you can see the 3D architecture of how your organ is supposed to look like. You can see the different ways the cells are layered. And this should give you a clue or an idea of how to layer your different cell types within your organ-on-chip model to recreate this basic minimal functional structure of the organ.
That organ-on-chip technology can replace animals from one day to another, and we will never do animal experiments anymore. This might be a misconception because the organ-on-chip is a fit-for-purpose tool, and I think it can really help to answer scientific questions that you already have or that you want to discover. But it gives you more an investigative field of view in the preclinical phases before you go into an animal experimentation. And if you already see that, for example, your drug is having a toxic effect in your model, why would you go then a step further to an animal model? You can just leave this out. So it helps you to really prevent excessive animal use, but it's not a full replacement at this time.
Organ on a chip is something very complex, something hard to do. I think this is a misconception. This is not true. Rather, I would say it's something new to do. But as long as you start slowly and easy and work your experimental design up and gradually up, I think you will be just fine.
One misconception would be that there aren't as many readout possibilities for organ-on-chip technology as for standard 2D cell culture, but that's basically not true. So also for the organ-on-chip technology, with the supernatants, you can do whatever supernatant-based assays you're used to. Also with regard to rescuing the tissue out of the chip, there's everything possible you also used to do with normal tissue culture, like imaging or PCR or whatever you want to like to do.